I'm Professor Don de Savigny. I look after the Innovations Hub for the University of Melbourne, located at the Swiss Tropical and Public Health Institute. And we try to develop the missing tools for civil registration and vital statistics development. So what is business process mapping? Well, it's actually not just the mapping. Business process re-engineering is what we need. And we've been really astonished at how powerful it is to actually map the processes, because when things fail, it's really because of processes. It's not because of the lack of money or the lack of people or the lack of technology, but basically complex processes are very difficult to string together. And there's nothing more complex than civil registration and vital statistics. If you think about it, you've got a birth which occurs as a +1 event in a community or in a health facility. It needs to end up as a +1 event in the vital statistics of the country at some later point in time. And a death that occurs in a community or in a health facility is a -1 event, which has to also work its way through into the vital statistics of the country. And so when we started this enterprise of trying to support strengthen civil registration systems, because they are basically broken in low-income countries, only maybe 30 or 40% of births are registered, maybe only 10 or 20% of deaths are registered. So those systems aren't really working. And they're not going to start working even if you throw more money at them. Systems are very good at giving you 40% births and 20% deaths. They're designed to do that. And if you want to get better, you have to change the system. You have to re-engineer the system. But what is the system? What are the processes? And so we tried to understand what they were, and we did that by first mapping these processes. It was originally to help us understand it so we could contribute to the effort. But in so doing, we realized that nobody really understood all those processes from end to end. Even the managers and stewards and people most responsible. It's because it actually passes through so many hands, so many stakeholders, and even so many ministries. You have the Ministry of Local Government, who may be responsible on the ground for civil registration. You have the Ministry of Health, which is very much involved with most birth and death events. You have the Ministry of Justice, which creates the legal framework for birth and death registration and vital statistics. Maybe have the Ministry of Home Affairs or the Ministry of Foreign Affairs concerned with deaths to citizens outside the country or visitors inside the country. So these are a lot of processes and a lot of complexity. And so we found that they got very excited about those process maps. They started to look at them together across their ministries and across their agencies and start talking to each other for the first time. And then in those process maps, they saw bottlenecks, they saw silos, they saw duplication, they saw redundancy, they saw problems. And then they started thinking creatively, how to improve the efficiency, how to streamline, etc. So the first step of the value of process mapping was getting people together on the same page with a visual representation, a map, if you like, of all the processes, all the major processes. And so that was a real injection of energy into all the efforts in the Bloomberg Data for Health countries. All of them started mapping the processes of birth and death in the facility, in the community, and thinking about them. And that we thought would be the end of it, but now we saw that was only the beginning. That they started using it in lots of ways we didn't anticipate. They started using it when they did a legal framework review, regulatory review, because we made the legal review very easy, because then they saw, well, do we have legislation for that? Do we have regulation for that? And then that led them to looking at, do we actually specify the requirements? Do we have rules about what forms, what information is collected? Because then they were seeing they were collecting the same information twice and trying to integrate it in different databases later and having all these difficulties. So that led them to actually having standard operating procedures and picking off these processes. And so in order to help understand that, we looked across the 20 countries to see the diversity. Now every country is trying to do the same thing. They're trying to register the birth, register the death, and hook a cause of death to it. But every country was doing it differently. The processes were different. So there's the mapping of the processes, standard operating procedures, the legal frameworks that are involved with all of those processes. But then, what next? What can you do with those mappings? So we looked at them and we realized there were 10 common features of all of the countries. They're what we call milestones, gateways, and you have to get through them. So the first one is whether or not the event is declared or notified to anyone in authority in the system. And without that first step, nothing happens afterwards. So if you fail that first step, it's over. And so then we said, what's the second step? The second step would be validation of that information. If it's validated, what's the third step? Then it's the registration. And once that happens, what's the next step? Is the certification and providing the family with a certificate of the birth, of the death, and so on. What's the next step? Is the sharing of that individual event information to those who need to know. If it's a health insurance company or life insurance company or a pension company or the family itself for other purposes. And then that event information now has to be aggregated into statistics. And then it moves from the vital event to the vital statistic. And it moves on. And then you have a lot of further steps, quality control, aggregation, assessment, and eventually dissemination and use of vital statistics. So there are actually these 10 major milestones. So these process maps help people identify if there are missing process steps, major steps, milestone steps. And it was quite interesting that in many countries, the first step was missing totally. And so it was not surprising that a lot of these systems fail to deliver if the first step doesn't happen. So countries started using these in different ways to start realizing they had to create more processes, use these process maps to start thinking about interventions. How do they change things? And if you're going to change it, you have your process maps which describe the current reality. Then it's rather easy on these maps to actually imagine a different process, to insert new processes, test them out conceptually with the stakeholders and so on, and then plan to make the changes. And so a number of countries have been actually creating death notification steps, and in so doing, taking advantage of new opportunities, new technologies, information technologies, internet, etc., to basically put in place things that couldn't have been done 5 years or 10 years ago. And so this is another huge value of process mapping, is the digitization of the information system. Moving into the 21st century, where we can design the information flow along with the process flows so that this all works together in basically lifting civil registration and vital statistics systems to a high level of performance. And that brings us to the last application of process mapping, is performance metrics. So once you have the plumbing, if you like, all these process lines of information as it flows from the family all the way to the vital statistics of the country, you can represent that by the thickness of the lines as to how much information is flowing through them and how much leaks out to be wasted away as dead ends. And so you can visualize the performance of the system where it is having problems. And this is a very big impetus to funders, partners, stakeholders, as to where they should put their next efforts into improving the system. Process mapping accelerates thinking, brings people together, stimulates ideas, and these things may have happened eventually one way or another, but the fact that the process maps just made it all possible to happen in 1 or 2 days of discussions is a real revelation. So for us, it has emerged as one of the most powerful tools. It's a system thinking tool, but it helps people think in systems and not just in technologies. And that is so important when we're dealing with trying to improve complex adaptive systems such as civil registration and vital statistics.